So, the contents of the pectoral superficial fascia are the nerves, the cutaneous vessels and the platysma muscle. The most important and most modified and special content of the superficial fascia of the pectoral region is the breast. The breast, also known as the mammary gland, breast also known as mammary gland, the word mammary is derived from the word mamma. This word, the mammary gland, is derived from the word mamma. The meaning of mamma is related to nutrition. Nutrition, and finally the word nutrition came from the mother. In mature females or adult females, after the birth of the child, the mammary glands are forming the accessory reproductive organs of the adult or childbearing females, and these are related to the secretion of the milk and finally the nutrition of the newborn. So, word mama related to nutrition or mother, so named as the mammary glands or also known as the breast. The milk which is secreted by the breast or the mammary gland is a complete nutrition. This is the only nutrition which forms the complete nutrition, otherwise no nutrient is complete nutrient, only the breast milk is the complete nutrition. So, these are forming the part of the reproductive system and also related to the secondary sexual characteristics in the females. Although the breasts are present in males and immature females, but these are almost rudimentary. So, again the clavicle, the sternum also known as breastbone, this is the humerus, this is the coracoid process and this is the acromion process forming the acromioclavicular joint, and this is the coracoid process. So, when we see the extent of the breast, we can see the vertical extent from the second to sixth rib. This is the second rib. This is the sternal angle of Lewis. This is third, fourth, fifth, and this is the sixth rib. So, when we see the vertical extent of the breast or the mammary gland, vertical from second to sixth ribs. The horizontal location or extent of the gland, it extends from the lateral margin of the sternum up to the mid axillary line. It extends from the lateral margin of the sternum medially and the mid axillary line laterally. The line which is extending between the anterior and the posterior axillary fold is the mid axillary line. So, in mature or adult female, it extends from the lateral margin of the sternum up to mid axillary line. This is the horizontal extent, and the vertical extent from the second rib, third, fourth, fifth, and up to sixth rib. The gland is made up of three types of tissues. The bed of the breast, the breast bed or the underlying structures, in upper and the medial part. This part of the breast is lying on the pectoralis major muscle, this part is lying on the serratus anterior muscle, and the infero-medial part is related to the aponeurosis of the external oblique muscle of the abdomen. The external oblique is overlying the rectus abdominis muscle. This is overlying the rectus abdominis muscle. This part is related to the pectoralis major. This is having a relation with the external oblique muscle of the abdomen, and this part is overlying the serratus anterior muscle. But the breast are not overlying directly on these muscles. When we see the transverse section of the breast, this is the pectoralis major muscle. The fascia which is covering the pectoralis major muscle is the deep fascia, and this fascia is known as pectoral fascia. So, this is the pectoral fascia. Major muscle. This is the pectoral fascia, and between the base of the breast and the pectoral fascia, we can see a space which is occupied by loose areolar connective tissue. This space allows the breast to move freely on the chest wall. This space is known as retromammary space. So, this is the retromammary space. So, the breast is overlying the muscle, but muscle is covered by the pectoral fascia, and between the pectoral fascia and the base of the breast we can see retromammary space, which is having loose areolar connective tissue, which allows the breast to move freely on the wall of the chest. The shape of the breast, the shape may be pendulous or conical or hemispherical. Extending from the second up to the sixth rib. The breast is made up of three types of tissues: the skin, the parenchyma and the stroma. To make the study of breast more convenient, we can divide the breast in three parts: the skin, the parenchyma and the stroma. The skin is also having some modifications like the nipple, the areola and the breast proper. The parenchyma is made up of the glandular tissue, which is a compound tubulo-alveolar gland, and it is a modified sweat gland. Again, the parenchyma of the breast is made up of 15 to 20 lobes, which are formed by modified sweat glands, and these glands are compound tubulo-alveolar glands. The glands are separated from each other by septa, which are formed by fibrous modification of the superficial fascia of the pectoral region. So, it is made up of skin, the parenchyma and the stroma. Stroma is again having the fibrous tissue and the fatty tissue. Fatty tissue is forming the main contour and the mass of the gland, and contour, the rounded or hemispherical or conical, is provided by the fat. The fibrous septa are forming the suspensory ligaments which anchor the skin on the underlying fascia, and it is forming the suspensory ligament of the Cooper. First of all, I will talk about the skin of the breast. This is the outline of the breast. This is the nipple of the breast. Here we can see here the nipple of the breast. The nipple of the breast is having 15 to 20 openings of the lactiferous tubules. Here we can see the openings of the lactiferous tubules. And it is having circular and longitudinal muscle fibers. So, it is having the circular and longitudinal fibers. When these circular fibers contract, these circular fibers will lead to erection or stiffness of the nipple during sucking by a newborn, and the longitudinal fibers of muscles will lead to flattened nipple, or these will revert the erection of the nipple. Again, circular fibers, when these fibers contract, these muscles will lead to erection or stiffness of the nipple. It happens during the time of the sucking. When the longitudinal fibers contract, these fibers will lead to flattening of the nipple, and it is having 15 to 20 openings of the lactiferous tubules, which are openings of the 15 to 20 lobes of the modified sweat glands. The surrounding part of the nipple is known as areola. The word areola roughly the location of the nipple is 10 centimeters from the midline or roughly it can be seen at the level of the fourth intercostal space. Medial to mid clavicular line. So, medial to mid clavicular line at the level of fourth intercostal space and roughly 10 centimeters away from the median line or median plane. This is the median plane, 10 centimeters from the median plane. We can see nipples in the fourth intercostal space. The surrounding part or surrounding skin of the nipple is having some pigmentation. In males and in immature females, it is reddish or pinkish in color. So, this is the areola at the base and surrounding of the nipple. But when the mature female is pregnant, this part is having some sebaceous glands. The outer part of the areola is having sebaceous glands, some sweat glands and some accessory mammary glands. So, this is the areola. During the time of pregnancy and lactation, these sebaceous glands are enlarged and these glands are known as tubercles of Montgomery. These sebaceous glands or tubercles of the Montgomery secrete oily secretion, the sebum, which prevents the nipple and areola from crackling during the time of the sucking. So, these enlarged sebaceous glands in the peripheral part of the areola are known as tubercles of the Montgomery. This is the nipple. Besides these tubercles of Montgomery, it is also having some accessory mammary glands and sweat glands. At the time of pregnancy, the areola becomes more pigmented and it becomes blackish in color, and this staining or pigmentation of the areola at the time of pregnancy is permanent staining. This staining never change or there is no depigmentation after the pregnancy. This color or this staining remains permanent. So, what is the areola? It is a surrounding of base of the nipple which is having sebaceous glands in its periphery, which is having the sweat glands which is having the accessory mammary glands and which is stained or hyperpigmented at the time of pregnancy and lactation, which is a permanent stain. So, this is the modification of the skin, the areola and the nipple. Now, how the parenchyma and the stroma of the gland are arranged inside the breast or mammary gland, how the ligaments of Kupffer are supporting the skin and the parenchyma of the gland. This part of the gland is having an extension this extension towards the axilla is known as axillary tail of spans. This is known as axillary tail of spans, and the opening in deep fascia from where the axillary tail of the spans is passing is known as foramen of the langer. So, this is the foramen of the langer. Foramen of the langer. This axillary tail not present always not present, and it is helping in drainage of the lymph from the breast to the anterior axillary lymph nodes. The axillary tail of spans is related to the drainage of the lymphatics from the breast to the anterior group of the lymph nodes of the axilla. Sometimes this axillary tail of the spans is enlarged and it is misdiagnosed as the lipoma. So, do not get confused when you see the lipomatous swelling in the axilla in females, young females, adult females, mature females. Always suspect the diagnosis of the enlarged axillary tail of the spans. After a short break, I will talk about the parenchyma and the stroma of the breast.